year often inspires a fresh focus on health, especially weight management for a lot of people. And if you're somebody who is struggling with obesity and medical issues related to that, you might consider contacting the weight loss team at Unity Point Health. Dr. Leon Siegel is a minimally invasive general and bariatric surgeon with Unity Point, who is here with details on safe and effective approaches to weight loss. Thank you so much for being here, Doctor.
Thanks for having me.
Yeah, of course. I just look at this as such a great opportunity for people to get those questions answered. I think a lot of times it's difficult for somebody to even pick up the phone, make the appointment. It's scary in a lot of circumstances. So I'm really glad that you're here and you can talk a little bit about this for a lot of folks who are starting the new year thinking, you know, this is really something that they want to tackle and it's important to them. So let's start with you. Tell us a little bit about your work as a bariatric surgeon and what that involves.
Sure. Well, yeah, thanks for having me. It's definitely an exciting time of the year for people trying to make changes, and diets are always at the forefront of our thoughts in January.
Sure.
So, but yeah, so I'm a general and bariatric surgeon. So what that means, I meet and work with patients preoperatively before surgery and try to make individualized treatment plans for them, and I meet with them as they're preparing for surgery and going through the preoperative program. I perform the surgeries themselves, and then after the surgery I spend time with them and help try to keep them on track as they go through their weight loss journey.
Yeah, it's difficult, and it's, of course, something that, you know, many people have tried, you know, over and over again, you know, to tackle that issue, and it's not easy. So, you know, this could be something that can help. When it comes to weight loss surgery, though, there are different types and procedures that are available. So, how do you help patients kind of decide which options are the best for them?
Sure. So, there are several different types of bariatric surgeries, and they actually are coming out or trying different newer ones in the last few years.
Okay.
At Unity Point, we stick with the tried and true gastric sleeve and gastric bypass.
Okay.
The gastric bypass especially has been around for 50, 60 years.
Yeah.
Not always with the goal of weight loss in mind, but actually it was started by Dr. Ed Mason, who was a surgeon up the street at University of Iowa. So
really?
Yeah, so not too far away in Iowa.
I did not know that. That's crazy.
Yeah, so we do that, and then we also perform the gastric sleeve, and both have amazing weight loss results, and they're very safe surgeries, which people are always surprised to hear. Their safety profile is the same as taking your gallbladder out or taking someone's gallbladder out, same rate of complication.
Yeah,
so
absolutely. It's just, it's good to kind of know your options and know what's best for you, and a consultation or just simply meeting with you or someone from your team, I'm sure could help, you know, clarify. Now, for individuals that may not be a good candidate for surgery, because I'm sure you run into that often, you know, somebody comes in and you kind of have to say, I don't know if this is right. So what non-surgical approaches can you offer, if any?
Yeah, so we have a lot of resources for that as well. So I should mention some of the decision making that goes into the type of surgeries that patients have are a patient preference, and then some additional symptoms, like if they have bad heartburn or gastric reflux, or history of, or if they've had multiple other abdominal surgeries in the past. But if for some reason we don't feel that they're a good candidate for surgery, additional resources we have, for example, our nurse practitioner, she focuses on the dietetic or nutrition side, Tracy Rocky, and she works with the patients to develop personalized meal plans, exercise regimens, and she provides or prescribes medical weight loss, so the medications that we have heard so much about in the news these days. And
and that was honestly something that we were going to talk about today, because we are hearing so much about GLP-1 drugs. I think for a lot of people they use like a blanket Ozempic, but there are so many that are out there right now. So they've been a hot topic. Can you kind of explain what they are for our viewers, and you know, just talk a little bit more about what people need to know if they are planning on using these and they want to be safe with it?
Yeah, sure. So GLP-1 is a peptide that the body makes naturally, and the levels of it actually go up naturally after bariatric surgery, gastric sleeve, gastric bypass, so the levels naturally go up. And they help with metabolism, they help with satiety, so actually getting that feeling of being full after a meal. And so the medications kind of mimic that, those effects. And really the important things to think about when you're undergoing medical weight loss is it really should be under the supervision of a medical provider.
Sure.
I know that there are compound pharmacies and you can order these types of medications over the internet, which is fine. I'm all for patients having access to
Sure.
appropriately priced medications, but you do want to have some sort of medical follow-up, because oftentimes what I see is people take these medications and they just stop eating, and they think that's the right way to lose weight. And it's not that you should stop eating.
Right.
The amount you eat goes down, and that's how you lose weight, the volume, the number of calories. But it's really important to continue exercising, to continue impact training, because you don't want all the weight you lose to be your muscle.
Your muscle, yeah, absolutely. And you still need some sort of nutritional value in the things that you're eating. Yeah, that makes perfect sense. Well, you have a great weight management team, specialists at Unity Point. So, you know, weight loss for a lot of people, it's about more than just the numbers on the scale. And
Oh,
it can be,
absolutely.
as we heard today, it can be very life-changing. So if anybody wants to reach out, they can just actually head to the website. You've got a whole page with tons of information for folks before they make that appointment. If you want to check it out, just go to unitypoint.org. You can also call the number on your screen, 309-779-4400. Dr. Siegel, thank you so much for taking the time today just to come on the show and explain all of that to
Thanks for
everybody.
having me.
Yeah, absolutely.